Tourette syndrome is one of the prototype tic disorders. So it usually affects young male patients, and the prevalence is around 0.03 to 1.6 percentage. So basically, Tourette syndrome is a combination of multiple motor tics, often by accompanied with phonic tics, especially with coprolalia. The patients can actually voluntarily suppress the tics for short periods of time, but over time they have an irresistible urge to express them, and eventually it comes out. Sometimes when they try to really suppress it for a long time, it just burst out with multiple tics. The onset is usually around a mean of 7 years, and some may actually tend to disappear in adulthood. The associated disorders with Tourette syndrome is anxiety, depression, ADHD, and obsessive compulsive disorder. And the name Tourette syndrome is named after the French neurologist who had described it, that is Georges Gilles de Tourette. So, the latest Harrison, they've given certain genetic risk factors for Tourette syndrome. One is the SLP gene, your TRK-like1 gene, and HDC genes. And the risk of a family with one affected child and having a second one with the Tourette syndrome is around 25%. So how do you treat a patient with tics? So commonly used medications, pharmacotherapy for tics is clonidine, which is an alpha agonist. Guanfacine, which is also an alpha agonist, but however can be given as an OD dosing. For very severe cases, atypical neuroleptics like risperidone, olanzapine, or ziprasidone can be used. And for very troublesome focal tics, botulinum toxin is a treatment option. Other medications are ecopipam, which is a D1 antagonist, and upcoming treatments, as given in the latest Harrison, is a wrist device which can actually deliver electrical pulses to suppress a tick. And next is closed loop DBS. So we have read about DBS for dystonia. We've read about it for Parkinson's. We've also read about it for the essential tremor. So there's an upcoming treatment option of closed loop DBS for tics also. So the targets over here is either the anterior portion of the internal capsule, the globus pallidus, or the thalamus.